You think this is cause to be concerned that I'm just a non-responder. Hello and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your weight questions, you're in the right place. Welcome. I have been on tirzepatide for 13 weeks and I'm at 12.5 milligrams already because the lower doses did not work. This dose seems to be hitting right, but I've only lost 10 pounds so far, and that seems well below average. And I really wonder if much of the loss is only because I've increased my time at the gym and have been tracking my food better and mostly meeting my protein goals since starting. Do you think this is cause to be concerned that I'm just a non-responder? I do get appetite suppression. It's quite good for 3 days. And then I have 4 days of fare suppression. What a great question. Okay, so I'll answer this generically. If somebody's appetite is suppressed and that is helping them with their food, I wouldn't necessarily, so it's helping in terms of the portion, the types of food, things like that. I wouldn't necessarily consider them a non-responder unless they just hadn't lost any weight. But for those people, like maybe they haven't lost as much weight as I would expect, but they're still getting some benefit of it. So in these cases where people are just not losing as much as I would expect, it's always kind of you're looking closely at the benefits versus the risk and also how the patient is feeling about that. I can't answer personally whether you're a non-responder because you're not my patient, and also I don't have all your numbers in front of me, so it's hard to calculate your percent body weight lost. Typically, I won't usually consider somebody a non-responder until I've gotten them up to the 15 and they've at least been on that for a couple months. So I usually give people a bit more time on the highest dose if they can tolerate it. And it also sounds like you are doing all the right things in terms of the lifestyle changes. And of course, sometimes there are going to be more significant changes in body composition versus the scale if somebody's changing all that at once. So I think a really good question to ask yourself, or for anybody to ask themselves, is if I didn't know what the number on the scale was, how would I feel about my body and my health? Because we tend to get very fixated on this scale number. And as we know, and BMI, as we know, those numbers are just one part of the story. They're not the whole narrative. And I think it's very easy for people to, kind of base their mood on where their weight is. And I think what we really want to incorporate is, how are you feeling? How are things going? If you couldn't use a scale for the next month, do you have a sense of how things are going and how you're feeling? I always think going by how clothes are fitting, and not like stretchy clothes, but clothes with an actual waistband, right? Clothes that are not so stretchy. I always think that is a really useful metric as well. Like, how are you feeling in your clothes? Are you wearing things that you weren't able to wear for the last few years? These are also really important signs that things are moving in the right direction for somebody. So my short answer, if I had a patient on 12.5, they've lost some weight, but maybe not as much weight as I was expecting them. Of course, I'm making sure that there aren't other medications that might be competing with this, but if everything looks good from a medical chart perspective, my goal is to get them up to the 15, keep them there for a couple months, and then really make a decision in terms of how much benefit they are getting from this medication and how far it's going to take them. So what an excellent, nuanced question. Thank you. If you have a question after the video, you can leave it on this video or you can put it on another video. I'll find it and I will add it to the list. If you want to work with me directly, I do work with people as a life coach to help with the non-medical aspects of weight loss. I help people around the world with this, people who can't get themselves to a gym, people who have a very, they may be on a GLP-1 and they still have a very chaotic or unstructured or difficult relationship with food, people who want to try to do the best that they can to never start a GLP-1. I work with a lot of those people as well. So if you are interested in hearing more, I will leave all that info down below. Thank you so much for watching, and please be well.